Welcome to today's lecture on scleritis. This rare and serious eye condition involves inflammation of the outer layer of the eye. Throughout this lecture, we will explore its anatomy, classification, clinical presentation, diagnosis, management, prognosis, and recent advancements. Let's begin. Understanding the structure of the sclera is essential for understanding the causes and mechanisms of scleritis. The sclera is the outer layer of the eyeball and consists of multiple layers that provide support and protection to the eye. Scleritis can be classified into different types, each with its own distinct features, severity levels, and management strategies. The three main types of scleritis are anterior scleritis, posterior scleritis, and necrotizing scleritis. Anterior scleritis, the most common form, is further classified into diffuse, nodular, and necrotizing subtypes. Posterior scleritis can present with choroidal swelling, elevated optic nerve, or posterior scleral thickening. Necrotizing scleritis is characterized by progressive tissue destruction. Familiarizing yourself with these classifications will enable you to recognize and differentiate between the various types. Exploring the underlying causes and mechanisms contributing to the development of scleritis is crucial for effective management. Scleritis can be associated with autoimmune diseases such as rheumatoid arthritis, granulomatosis with polyangiitis, and systemic lupus erythematosus. Infectious causes, like herpes zoster, tuberculosis, and syphilis, can also contribute. Understanding the pathogenesis, which involves immune-mediated inflammation and activation of pro-inflammatory cytokines and chemokines, will help elucidate the disease process. Recognizing the signs and symptoms of scleritis is essential for accurate diagnosis. Patients with scleritis often present with severe eye pain, redness, photophobia, sensitivity to light, and blurred vision. The pain is typically described as deep and boring, differentiating it from superficial ocular conditions. These clinical features, along with a careful ophthalmic examination, aid in establishing an accurate diagnosis and differentiating scleritis from other similar conditions. Diagnosing scleritis requires a combination of clinical evaluation and various diagnostic tests and procedures. In addition to a detailed slit lamp examination, additional investigations such as laboratory tests, including erythrocyte sedimentation rate, C-reactive protein, rheumatological workup, and imaging techniques like ultrasound and magnetic resonance imaging, MRI, can be helpful. Familiarizing yourself with these diagnostic techniques will facilitate the accurate and timely diagnosis of scleritis. Distinguishing scleritis from other ocular conditions with similar clinical presentations is essential to provide appropriate management. Episcleritis, which shares some symptoms with scleritis, can be differentiated by the presence of localized redness and a lack of severe pain. Dry eye syndrome, infectious keratitis, and even uveitis can also mimic scleritis, making a thorough differential diagnosis crucial for effective treatment. Understanding the potential complications associated with scleritis is important for long-term management. Complications can include scleral thinning, uveitis, corneal involvement, and even scleral necrosis. These complications can have a significant impact on visual outcomes and may necessitate further interventions. Early identification and appropriate management can help minimize the risk of complications and preserve visual function. Various treatment strategies are available for managing scleritis. Nonsteroidal anti-inflammatory drugs, NSAIDs, are often used for symptomatic relief and can help reduce local inflammation. Corticosteroids play an essential role in controlling the inflammation associated with scleritis. Immunosuppressants and biologic agents may be indicated in refractory cases or when systemic diseases are involved. Knowledge of these medical management options is crucial for tailoring treatment plans to individual patients. In complex or severe cases of scleritis, surgical interventions may be required. Procedures such as scleral grafting or tectonic procedures can help address scleral thinning or necrosis. Surgical interventions are often reserved for cases where medical management fails or where there is a risk of structural compromise. Understanding the indications and techniques for these interventions will broaden your treatment options. Evaluating the long-term prognosis of scleritis is vital for patient counseling and management planning. Scleritis can have a chronic course with a risk of recurrence and may lead to visual impairment and a negative impact on the patient's quality of life. Recognizing the potential outcomes will enable you to better guide patients through their treatment journey and address their concerns effectively. As with any field of medicine, research and advancements are continually being made in the understanding and management of scleritis. Staying updated with recent developments, including emerging therapies, novel treatment targets, and ongoing clinical trials, will help enhance patient care and provide the best possible treatment options. To gain a comprehensive understanding of scleritis, it is important to delve into the immunopathogenesis underlying this condition. Immune-mediated mechanisms, involving various cytokines, immune cells, and inflammatory pathways, contribute to the development and progression of scleritis. Exploring these mechanisms will provide insights into potential therapeutic targets and the rationale behind current treatment strategies. In conclusion, scleritis is a multifaceted condition that demands thorough evaluation and meticulous treatment. By grasping its complexities, including anatomy, classification, etiology, pathogenesis, clinical presentation, diagnostics, differential diagnosis, complications, management options, prognoses, recent advancements, and immunopathogenesis, you possess the necessary knowledge to identify, diagnose, and effectively manage scleritis. Remaining current with research and innovations will allow you to continually enhance patient outcomes in the realm of scleritis.